And really, it comes down to 4 areas. We're going to be looking at creating the data. Really, that's the preparation. What's that look like? And then the transforming of the data. How are we going to translate that and send that to the lab? How are we going to communicate that information to the lab? It's just not about the prep. It's about a lot of other components: adjacent teeth, opposing teeth, the tissue, the embrasures. You have to think about emergence profile, a lot of considerations there. You're also going to be looking at lab processing. We'll touch on that a little bit, as well as then the final placement or securing of the restoration. The first thing to recognize is digital preparations are different. They're not like analog impressions. Analog impressions are a lot more forgiving. That's the first thing I want to share. And here's why. You've got to be really careful. First off, make sure with all of your digital impressions and scanning that you have truly the proper occlusal reduction. When you're doing digital and scanning like you see here, you know exactly how much reduction you need, what's required, and what to prepare for. And you can see here the comparison of the preparation, whether it's a true tissue style picture, as well as a stone model that I like to place up. And that's how I usually like to mark my margins if I do need to mark my margins. And then again, the occlusal relationship between both of the opposing and the prepped tooth. And you can see here exactly the detail in which we're able to immediately identify where we're at, how much. We can kind of weather map that occlusion to see where we're hitting the hardest. We can also look at excursions with this and really have predictability with that occlusal reduction, which is so very critical. Use burs specifically for what they offer and look what their measurements are, in which then you can use that as a ruler. So then when you create your depth grooves, say, for example, for your occlusal reduction, you're spot on. You have no question whatsoever. So in this great example, I love to show and a flat end taper, absolutely the perfect burr to start doing depth grooves on that occlusal table. Take away proper reduction, but round and take that occlusal surface, properly taper it and round everything to have just a nice undulation of coverage. You might have a preparation that is lacking immediate retention and might be a shorter height in preparation. Then you might consider doing a groove or a box form. And here's a great digital example of what that looks like. Whenever I'm going to do these type of add-ons here, the grooves or the boxes, I like to do grooves often, just for rotational purposes. And again, increases the surface area. You want to smooth all of the surfaces, make sure your finish line is very identifiable and clean and work clean. I like to use a lot of chlorhexidine. We mop off our preps routinely, remove the debris. I use lots of water when I'm doing this, but again, keep things smooth and keep things identifiable. 2 of the techniques that I routinely use, depending on whether I have an equal or super gingival restoration, I often will use a single cord technique in that fashion. For the double cord technique, you want to make sure, again, that you're doing not only a horizontal displacement, but also a vertical displacement. So you're going to pack a smaller cord. Often I'll use a 000 knit pack initially, and then follow that up with a 0, sometimes even a 1, just depending on the tissue type, the margin, the aesthetic line, etc. Rinse initially, take and pull the cord then, and you're ready to take your impression. And in this case here too, we can leave the lower cord, the 000, in place, go ahead and scan, and then remove that when we're all finalized with our scan. So again, air the margins, everything that you see here, cite them, evaluate, and then you're ready to scan. Here's that final scan that you can see here, clear margins, able to create a beautiful restoration from that. And we have to understand what the computer-aided design parameters are too. We have to understand what is it the lab needs from us to make a better restoration, but sometimes they're garnered with design parameters that we've exceeded maybe. So we have to know what they need from us. And that's why it's very important. Have a good open conversation with them about how you can become better in relaying that information to them. And they're going to help make you a better dentist and obviously better for your patients. Talk again to your lab, see what they like, what they're best at, what they're best at creating, and then work backwards from those dimensions. Use your burs to help measure and create some beautiful results.